Oops, LinkedIn says you're not approved. Okay, whatever. Go live. Maybe that was the problem. Wait.
It's weird. Yeah, I can still see myself, but not you on mine. On my computer, at least. So.
Oops, LinkedIn said for more information. I think we're live.
Well, let's do it, I guess.
On Facebook and YouTube, but not on LinkedIn. So,
okay.
All right, let's try this. Okay, well, everybody out there, welcome to Beyond Telehealth. We have no idea if you can hear us. We hope you can see us. This is, as we say, the telemedicine adventure, right, Neelesh?
Absolutely.
Okay, so right now, we're having some technical difficulties, so we are using our phones to hear, and various things are muted, so hopefully you guys can hear us. I'm Dr. Lisa Finkelstein, and welcome to Beyond Telehealth. Tonight we're going to talk to Dr. Neelesh Kenia, and he's going to introduce himself. So Neelesh, tell us what specialty you practice, where you practice, what EHR you use, and what telemedicine platform you use.
All right. Well, thank you for having me, and hopefully people can hear us and the adventure of 2020 continues. But so yeah, my name is Neelesh Kenia. I'm a pediatrician and primary care sports medicine physician. I practice in San Francisco for the Permanente Medical Group and Kaiser Permanente, and I split my time doing outpatient general pediatrics and sports medicine. I'm the assistant chief of our pediatric department here in San Francisco, and I also do some teaching with our pediatricians, with UCSF, med students, and residents as well. So my days are always different, which keeps it interesting, which is always fun.
You were using telemedicine prior to the pandemic, so we're not going to waste a lot of time talking about the pre and all that stuff. So how has everything changed for you over the last 9 months with telemedicine?
Yeah, so we use Epic, and we have been using telemedicine for years. In our healthcare system, we used telephone visits, and we had started doing video visits a couple of years ago. And the biggest change has been the adoption of the video visits. So before, because our patients were used to accessing us on phone, we would set up phone visits all the time. And when we kind of tried to broach video visits and kind of explain the benefits of it, a lot of our patients were, oh no, I'm happy just talking on the phone. And then with COVID, that has changed a lot. And now a large majority of our patients are happy and actually asking to do video telehealth rather than just phone telehealth.
So looking ahead into where your practice is going to be post-pandemic or during the pandemic, how do you think that telemedicine is going to be included in your everyday in the future?
Yeah. No, I was going to say, I think it's here to stay, and I think it will be a significant proportion of what we do going forward. I guess time will tell what proportion that is. And, you know, in my pediatric world, there's definitely times where we still need to see patients, and we have a lot of patients who need to come in for their vaccines. And so all of those visits, we still need to have them come in for. But I think both physicians and patients are getting more comfortable with taking care of things on video and figuring out what actually works well and what doesn't work as well. And just the amount of time saved on both ends when someone can just do it from their home or from their office and get their needs taken care of. I think those benefits are huge. And so I foresee us using it even more. And I think as people are more comfortable being on video, I think more and more people will use that as opposed to just telephones.
Right. You know, the new paradigm is rather than bringing patients into the office or into the hospital, it's bringing healthcare to the patient where they are. And that's a whole different way of thinking than we're trained to think, and how patients are trained to think. What's your opinion about that moving forward with this new consumer-based healthcare?
Yeah, I mean, I think it's a good thing, and I think we've kind of tried to allow patients to access us that way in the past, and we also have free access for patients to email us. So the way I like to frame it to the patients, we want to take care of your whatever you need in the best way that we can. And so if that is easy to take care of over email, great. We'll check it off and take care of it over email. If we can do it over a phone call, great. If we can do it over video, great. But if it requires you or it's better for you to come in, then that's great too. And so we can figure out what the best way to take care of the issues that you have are, and we'll match that. And so sometimes that might be a video, sometimes that might be coming in, sometimes that might be a quick email. And as people are more comfortable with whatever they're comfortable with, we can meet them where they are.
Yeah, for me, one of the aha moments was talking to a mother who was in her mid-30s, has three kids. And in the original model of telemedicine, it was bringing the patient into a clinic, an originating site. And then and this would be like in a more rural clinic.
Mm-hmm.
In order to, and it had to be an established patient. Couldn't do it for a new patient visit. And this woman said to me, Lisa, if I never have to come into a doctor's office and bring my kids in, I have to work, I have three kids. And that was like a light bulb moment for me, because the traditional model of I know my physician, I love my physician, is not how it is with younger people, especially if they're working.
Mm-hmm.
You have that.
Yeah, I mean, I think the convenience factor is huge, and I think I practice in San Francisco, so in an urban environment, and so sometimes people are taking a Muni train to a bus and then walking a few blocks to get to our clinic, and it can take them from the time they leave their home to the time they get back home. It can be 2 hours or 3 hours or something like that, and if they could be sitting at home and just hop on for 15 or 20 minutes on our phone or video, that's huge. And I think, going forward, I foresee, and we had started this pre-pandemic, and we've been doing it even more of even, having delivery for medications and things like that. So if you can take care of everything on the phone or sitting at home and then have your medicines delivered to you and save the trip to the doctor, waiting at the pharmacy, all those things, it's a huge savings, and definitely people who have to have kids at home where they have to schlep all three of their kids because they don't have anyone else to take care of them, and so trying to get them all loaded up into a car or on a bus or something, it's pretty difficult, and so now parents can just stay at home and do that. So I see it as a win-win, and I think I think a lot of physicians were nervous about it at first, feeling like we have to, put our hands on a patient in order to treat them. And we're finding there's a lot of things you can do by getting a good history, as we're taught in medical school, and being able to virtually put your hands on the patient and see what's actually going on and take care of a lot of issues that way.
Have you ever had a mom do a visit with you when she was out shopping with her kids or some other place besides home?
I've had all sorts. I've had people out shopping. I've had people out at the park. I had a mom that I had to tell her, I think it'd be better if you pull over rather than trying to do this visit while you're driving. So yeah, I've had all sorts of different backgrounds for the visit, but we usually are able to make it work. And people, as long as we're not talking about personal or confidential issues, I'm always fascinated that people are willing to talk about their healthcare in the middle of a grocery store, but people do.
Yeah, we have to figure out what we call this website manner. Doctors have to have it, and patients have to recognize that this is really, truly a visit,
Mm-hmm.
and you keep shopping at, Kroger's or Albertsons or whatever and see your doctor.
Right.
So one of the questions I wanted to ask you was about the vaccinations for the kiddos. That is another thing, in the adult population, it's that cancer screenings are not happening. Pediatric population, vaccinations aren't happening. What's your experience with that?
Yeah, so I think as pediatricians we all worry about that, and there's been some good documentation and studies that have shown that we've had a significant decrease in vaccination rates. One of the things we did early in the pandemic is when we weren't seeing patients, we set up essentially a drive-through or drive-up vaccine clinic where patients could just drive up, park. And then a nurse would meet them at their car, bring them into into a side entrance to a little clinic room on the first floor of our building, so they wouldn't have to go into the main building, get their shots, and walk right back out to their car and go. And in some of our clinics that are further out in the suburbs, they actually truly had a drive-up clinic where they just drove up outside and had their shots done. And so I think we figured out ways to adapt even with that, so that we could still maintain our vaccination rates. So we've been actually able to maintain our vaccination rates in our population pretty well by just doing outreach and setting up places where families felt comfortable and safe getting the vaccines done.
Right.
Well, that's a great example of being proactive and having plans in place. Tell me a little bit about the sports medicine side of what you do, and how does that work with telemedicine?
Yeah, so I work as a primary care sports medicine doctor part of the time. I see mostly young athletes, so preteen, teen, and college age kids. And similarly, I think initially people thought, well, there's no way you could do a knee exam or a shoulder exam on a video. And what we found is, there are certain things you definitely need to bring in and you have to put your hands on in order to diagnose. But there's a lot of things you can assess on video. And so we actually, as our sports medicine group and several of us together, some of my colleagues put together, essentially a how to do a physical exam on video cheat sheets. And, we try to prep the parents or the families or the kids on, hey, we're going to do a video exam. We need you in shorts and a t-shirt. We need you in a space where we're going to have you move around. We may have to have you adjust the camera so that we can see your feet and your, hips. And we walk through some of the things that we want to do. And I've had families, palpate. I'll have the mom or dad palpate the kids joint, and I'll walk them through and show them on my knee. Okay, I want you to press here. Does it hurt? I want you to press here. Does it hurt? I want you to do this movement with your hip. Does that hurt? I want you to do a one-legged squat. And so we figured out that there's a lot you can assess even without putting your hands on them. And then, there are times where we absolutely need to bring them in either to get x-rays or to examine, acute injuries and things like that. So it's worked surprisingly well. And sometimes we've actually streamlined things so where we can see them and say, oh, this clearly needs to get further workup. Let's get that all done. And then I'll see you. So I'll have all the information when I see you.
Right. Yeah,
it's kind of a hybrid, a hybrid model.
Mm-hmm.
You have a great story, so let's leave it with your great story that you told me about the mom.
So, as we've learned and adapted during telemedicine, we've kind of stretched what we felt was possible or what we thought was possible. And so fairly early in the pandemic, when people were really scared about coming into the clinic, I had a video visit with a mom and a kid, and it was a little 2.5, 3-year-old who wasn't moving their arm, and got the history and in hearing about what happened, the mom kind of yanked the kid's arm as the kid was trying to run off, and that's kind of a classic mechanism for something called a nursemaid's elbow, which we see a lot in pediatrics, and it's one of the most gratifying diagnoses and treatments because it's something we can kind of fix in the clinic. But the mom didn't feel great about coming in the clinic because we were in the height of things. And so basically I walked the mom through on how to reduce a nursemaid's elbow. So a nursemaid's elbow, basically the radial head and the elbow, the bones get shifted and kind of popped out of place, and you have to pop them back into place. And so I walked the mom through on the maneuvers to do it and showed her on the video how to maneuver the elbow and the wrist and turn, and she felt a pop and she popped it back into place. And within 5 or 10 minutes, the kid was moving the arm and happy again. And so I never would have thought a year ago or a couple of years ago that I would ever consider trying to have a mom reduce a nursemaid's elbow, but lo and behold, she did it, and everyone was happy, and everyone got to stay home too. So it was great.
Right.
So we say it's simple.
Exactly.
It works.
Absolutely.
Right. All right. Well, I really appreciate you coming on and figuring out. I'm not sure what happened with the technology, but it's good that it happened. All right. Well, I'm going to end the broadcast and hang on for 1 second, okay?
All right. Well, thank you so much for having me. I appreciate it.
All right. Thank you.